When we talk about treating depression in young people, the conversation often jumps straight to medication. But for many children and adolescents, some of the most powerful interventions doesn't come with a prescription. They come from sleep, movement, connection, and purpose. Today, I'm joined by Dr. Sneena Praveen, who has spent over 3 decades working with children and young people as a child psychiatrist, and who has developed a memorable framework for thinking about this holistically. Hello, Dr. Sneena. Welcome to this conversation.
Hello, good morning, Dr. Anish. Thank you for inviting me, and hello to everybody who's attending this session. Well, talking about the framework, as you know, my client group is under 18s. So I treat people with depression under 18 years of age. And when I work with children, children and adolescents, the way I explain to them is by using this 7 Fs. F is for fluoxetine. Fluoxetine is a common antidepressant which is used. But before fluoxetine, I talk of other things which need to be incorporated, like fun, faith, friendship, family, fitness, food, and then fluoxetine. So it's a multi-pronged approach. It's a sort of a lifestyle change. The way I explain to them is, if you had diabetes, you would start off with cutting out sugar, exercising, losing weight. Medication is not the only thing which is needed. It's a lifestyle change. Similarly, for depression, a little bit of many things are needed to move a person away from depression. Talking of the other things, if it was mild depression, medication would not have been needed. But because the patients which come to me in the service are after having had therapy for years, and when they don't shift and when they don't move on, when they get stuck, they come to us when therapy has not made a difference. So we get internal referrals from other clinicians. So they are usually at a point where medication is needed, usually. But having said that, medication alone is not a panacea. It's not a panacea. It's not a miracle. It's not a magic cure. It needs to be combined with other things. When I talk of fun, it sounds cliched to say that all work and no fun makes Jack a dull boy. But fun is needed. It has to be a balance between fun and work. So fun is needed. When I talk of friendship, what I mean is not casual friendships. Studies have shown that, research has shown that if you have at least one confiding friendship, you can have more than one, but at least one where you can bare your soul, where you can be all of yourself with your flaws, with your shortcomings, and you're accepted no matter what, and you're loved no matter what. That's a safe place to be, and that helps with moving on. At least one confiding friendship. Loneliness is not good. Cutting yourself out is not good. Shutting yourself out is not good. You need to reach out, not build walls, but build bridges. So friendship, family, a family which is supportive helps with depression. Moving on, yeah. And then comes fitness. Now, I can't emphasize the importance of fitness like exercise. Exercise pumps up all the good hormones like endorphins, and it's a good antidote for depression. When I talk of food, what I mean by food is healthy food, full of nutrients, because anemia can mimic depressive symptoms, B12 deficiency can mimic depressive symptoms, hypothyroidism can mimic depressive symptoms, vitamin D deficiency can mimic depressive symptoms, and even micronutrients which are deficient can mimic depressive symptoms. So a good, healthy, balanced diet is useful. And then comes to faith. When I talk of faith, I'm not pushing religion onto them. I'm not imposing religion onto them. Nothing of that sort. When I talk of faith, it's not Christianity or church going I talk of. If they're doing that, fine. I have no issue with that. It creates a sense of belongingness, which is very much needed, because these days families are fragmented and people are generally don't have a sense of belonging. So that's fine if they have a faith in a religious institution. But what I talk of faith is something to ground you, something to anchor you, something to sort of hold you. And if you don't have an internal locus of control, you need an external locus of control. And some people have a very strong internal locus of control, and they're self-driven and they have self-belief. But if you don't have self-belief, which many of my depressed, low self-esteem youngsters don't have, they need to put it somewhere outside. So faith is useful. So all these are needed. And then comes fluoxetine. Fluoxetine is only a small part of a bigger, way of helping with depression. And one more little thing I tell them when I give them medication, I tell them it's like the air wings which you use when you go to learn swimming. You need to make the changes in here and in here and
Yeah.
and then medication will sort of help, and they have to meet medication halfway. Medication will not do all the work for them. They need to do some work and meet the medication halfway. It's like swimming, after you learn swimming, after you learn what to do with your hands and legs, you can get rid of the air bands or the floaters. Similarly, once you start getting better, you can get rid of the medication. It's not forever. It doesn't have to be taken forever.
That's all useful information. I think just getting back to the point about nutrition and food, there is also this understanding that B12 and folic acid, some of the vitamin deficiencies can lead to depression because these vitamins are known to have some role in the synthesis of serotonin, which is the neurotransmitter involved with
That's
low
right.
mood. So I think in that way as well. I think and clinically as well, just try to rule out these deficiencies before we start the medication. I was wondering, what do you think clinically is one of the most important factors when we consider medication?
I think it is, if there is biological features of depression, like sleep and appetite are affected, it is not exogenous, it is endogenous. We use these terms exogenous and endogenous. Endogenous depression is more biological, whereas exogenous is situational or contextual or stress related. So we check out for biological features of depression. That's one thing. Secondly, we look at the severity, how severe it is. If it's mild, it's not needed, but if it's moderate to severe, it's needed. And usually, as I mentioned, in the service that I work in, I get internal referrals, secondary referrals. So people have already gone through the talking therapies, or we call it psychotherapy. So they've already gone through CBT and whatever. And when there has been no movement, the other clinicians refer to us. So by the time they come to us, medication is usually needed because they've been therapied till the cows got home. So it hasn't worked. So it's needed. But having said that, I can tell you a small little story, of a young girl who came to me. And she was around 16 and a half, 17 years old. And she had gone through therapy. She had gone through antidepressant medication, and it had not made a difference. She was stuck, and I couldn't understand why the stuckness was there. And what happened was, her mother gifted her a present for her 17th birthday to go to Ghana to become a support teacher, like a supply teacher in a poor school. And the girl who went and the girl who came back was different. The mother said, the girl I put on the flight and the girl who returned from Ghana were completely different. My daughter is changed. And I said, what had changed? And what she said was she had got a purpose, and she had gone to Ghana and worked with underprivileged, disadvantaged children. And she came and told me one thing, something very poignant, something very, meaningful. She said, they get happiness in so little, in the sense, it was not a materialistic way of finding joy and happiness. And somehow something touched her. And she decided to go for teachers training, and decided her long-term plan was to go back to Ghana and become a teacher. So what happened was, suddenly something had shifted. She had got life in perspective because she had lived a privileged existence in the UK, and she realized that outside in the world, it's something different. So I think her depression was not exactly depression. Even we hadn't got it right. It was existential. It was an existential finding a meaning for life. So sometimes even we can't shift it, and something else has to happen, and the penny dropped in this case. So this was an unusual case. I'm not saying all the cases are like this. Many of them, most of them get better with depression and move on. But this was an unusual case. That's why I remember it so well.
Yeah, very interesting. And I think it's probably reminds us to kind of make sure that, have we looked at the cultural and the social, all the needs of the young person before we kind of, look
exactly
at
case. She also found a meaning, a purpose in life. And somehow her paradigm shifted, the paradigm she had in her mind shifted. The statement she told me was, people are so happy with so little. Means they were living in poverty, but they were so happy. They didn't need material goods. They didn't need iPad and iPhone and Nintendo and whatever, PlayStation to be happy, So that kind of a thing. Yeah.
I mean, I'm just curious to know that out of these 7 things, is there anything which you think is superior or more important, or do you think they all have an equal role?
If you ask me personally, I would believe friendship, connection. Personally. But I think all of them are important. But personally, connection, loneliness alone is a killer. Loneliness can kill. kill in the sense, what I'm saying is it's a
Yeah.
it literally brings you down.
Drain
So
you down.
connection is very important. We are all social beings. We
Yeah.
are not an island all by ourselves. There's a quote, isn't it? No man is an island
Yeah.
all by himself. So we are not an island all by ourselves. We need our connections. And connections are there. Our friendships are there for hanging out and for going for films. But one confiding friendship where you can be all of yourself is a protective factor. It's been shown in research. It's a protective factor. If you ask me, all of them are important. But if you want me to pick up one, I would say one confiding friendship and one true confidant, a person you can confide in. Even your darkest thoughts, you can confide in. Yeah.
Yeah. Okay, so thank you so much for the conversation we had, and it was really helpful. Before we wrap up, one small practical resource for parents listening. There's an app called How Well Do You Know Your Child? It's a nice low pressure way to gauge how well attuned you are to your child's day-to-day world, which really complements everything Dr. Sina have shared today about the connection and having an anchor and being protective. So this is an app which helps you to understand the child's inner world in a very fun and interesting way. I will put the link in the comments. Thank you once again, Dr. Sina, for your time. It was a wonderful conversation.
Thank you, Dr. Anish, for inviting.
Bye.
Thank you. Bye-bye.